Today's discussion is about nice guideline or criteria for CT head after sustained head injury in children. So if you're working in ED and you receive a child with a sustained head injury, so you have to look for one of the risk factor. Here I have mentioned 7 risk factors. So if any of these 7 risk factor is positive in a child, you have to go for a CT within an hour. The first risk factor is suspicion of non-accidental injury. So you have to go for CT because they're likely to look for subdural hematomas or intracerebral hemorrhages, and it may be an ongoing process. So this qualifies the child the imaging should be done. Post-traumatic seizure in a child with no history of epilepsy is another indication for CT head. If you receive a child and his GCS is less than 14, and if you receive an infant whose GCS is less than 15, or and when you reassess him, if let's say if his initial GCS of a child is more than 14 or 15 by 15, but if you reassess him after 2 hours and any GCS finding of less than 15 will qualify the child for a CT head. So for GCS less than 14 at arrival, for an infant less than 15, and for any age, if the GCS is less than 15 after 2 hours, you have to go for a CT head within the first hour. Immediately, not in this case because all the 2 hours will be like past. If you suspect or an examination you find open or a depressed skull fracture, that is another indication. If you find any of these, such as hemotympanium, panda eyes, or CCF nose or ear leakage or battle sign, uh, these are the indications that there is a basal skull fracture, and this should be investigated with a CT head. Focal neurological deficit in any form, that may be sensory deficits, this may be motor deficits. So if you are examining a child after sustained head injury and you find any focal neurologic finding, it is mandatory to go for a CT head in the first hour. And if you have an infant and you find a bruise or swelling or laceration greater than 5 centimeter, so it mandates to go for a CT head. Okay, usually we also do so CT brain plus bone window. This is collectively called CT head. Okay, uh, there is another set of patient that you have if like say none of the above 7 finding are present in a patient, then you have to look for uh, more than one of these 5 uh, findings. For instance, if a child is brought to you by AD and the parents say that he was unconscious for greater than 5 minutes, and it was witnessed by anyone, like say parent or teachers, so this is one risk factor. Vomiting of 3 or more than 3 episodes, abnormal drowsiness, amnesia before or after the event, or for greater than 5 minutes, significant. uh, Dangerous mechanism of injury. Dangerous mechanism of injury is that if it is a high speed RTA, let's say about or it's a fall from greater than 3 meter, or there is a high speed injury from a projectile. So you have, like as I said, in the first set of patient there was you have any risk factor would qualify for a CT imaging, but here more than one will be needed. So let's say witness unconscious and vomiting, so you go for a CT, uh, or any combination of two. So or more than one, it may be 3 or 4. So more than one is required to in this category to actually go for a CT head. Now let's say a patient has only this one risk factor, like wetness unconscious, greater than 5 minutes, no other risk factor. So, will you send him home or no? You will observe him for 4 hours, observe him for 4 hours, and then you have to have a look on GCS or vomiting and drowsiness. So if the GCS at some point of time is less than 15, or vomiting another episode occurs, or drowsiness another episode is witnessed, then you have to go for a CT. Okay, there is another subset or a patient which are some anticoagulation therapy for any reason. In that case, you have to perform CT within 8 hours, so you have to keep the patient in observation, and you have to perform a CT in 8 hours. So these are the indications for a CT head in a sustained head injury patient. In the first category, you only need one, and there's 1 out of 7. Here, 2 out of 5 are at least 2 out of 5, and if you have only one in the second category, then you have to observe for 4 hours. And any patient on anticoagulation therapy, you have to perform CT in 8 hours. Thank you so much.